Hello guys, welcome back to my channel. If you are new here, welcome. If you are returning, thank you so much for coming back. My name is Marian for those of you who are new. Today I am here to be talking about the RaDonda Vaught case and also to talk about my experience and encouraging nurses to speak up when there is a need. We are working in a system that is not perfect. Unfortunately, when we do make mistakes, those mistakes can result into the loss of life, which is just heartbreaking. So before I get into the background of this case, I first of all want to say, as a human being, my heart breaks for the family. My heart also breaks for this nurse. No one goes to work wanting to make mistakes. No one goes to work wanting to hurt other human being. It was a terrible incident that happened, but I think there's a lesson that we need to learn as medical professionals, to know that, we are human beings, we make mistakes. However, our mistakes can lead into things, something terrible like this case. RaDonda was a nurse in Tennessee who administered the wrong medication to a patient that ultimately resulted in the death of this patient. I will give a brief summary about this case. I don't want to retell the whole story. I just want to focus on what we can learn from what happened. For those of you who are not familiar with the case, RaDonda Vaught was a nurse in Tennessee. She was called by another nurse to go and administer Versed. Versed is a sedative to his patient, down in radiology. So this patient was sent to radiology to get a scan, and the patient was known to be claustrophobic, so the doctor had ordered Versed to be administered to this patient for the procedure. So RaDonda went to the Akidos to get the medication out. According to her explanation, she tried to pull the medication out, and Versed was not listed on this patient med list. So she called the primary nurse again and asked, so she went the second time to pull the medication out. Now it's important to know, I would say almost all medication has two names. So you have the generic name and you have a brand name. Oftentimes when medication are stuck in Omnicell pieces, it is stuck under the generic name instead of the brand name. However, we tend to throw around names of medication. We tend to pick the easier name to pronounce. I myself, I do it all the time. When I look at a med, I'm going for the name that is easier. So Versed, the generic name for Versed is mendazepine. Well, mendazepine, that's a long name. Versed is short and it's easy to say, so we tend to pick on the easier name. And unfortunately, when she typed in the system Versed VE, she got a list of medication. She got a list of all the medication that were listed or start with VE. And unfortunately, she pulled out Vicuridium. Vicuridium is a paralytic, so it's a medication that is fatal. So when she pulled out Vicuridium, according to her explanation, there was no warning on the Akidos. When you override a patient, you will get a warning sign. According to RaDonda, there was no warning sign, so she pulled the medication out. She went down to the radiology department. She turned the medication around, read the label to reconstitute the medication. Now, when I listened to her explanation, the clips that I listened to, I just in my mind can't really wrap my head around what was going on. I will give you my background. I am a nurse. I practice nursing for going on 7 years now. I work in the inpatient setting. I started my nursing career on the cardiac renal floor, and then in the last about 5 years now has been practicing as a float pool nurse. Just like RaDonda, I have been called by other nurses to administer medication to their patient. I have also been asked to go down to the radiologist suite to administer sedative to patients down in procedure. It is not uncommon for patients to be given Versed or lorazepam, which is another name, the generic name for Ativan, doing either a CT scan, MRI, and things like that. So this is something that is commonly done. So I felt the need to really speak up on this case and talk about some of my experience and things, and encourage nurses to truly speak up when there's a need, when you feel like that, when you feel like you are put in a position that is compromising patient safety and your safety. You need to speak up. If you have administered Versed, you know that Versed comes in a liquid form. Vacuronium comes in a powder form. So in order to administer it by IV route, you will have to reconstitute it. And RaDonda says she has given Versed. So I'm thinking she must have really been distracted to have to reconstitute a medication that she has never had to reconstitute. You never reconstitute Versed. She has given Versed before, but this vacuronium needed to be reconstituted. So she reconstituted the medication, pull out a dose before administering it to the patient. And I'm thinking we can really blame the system and say we work in a broken system, and that absolutely no doubt is true. But at the same time here, I think that we need to take responsibility here. The nursing community needs to step back and look at this case. For those nurses who are talking about how terrible it is now and nurses being charged in the criminal system is just awful, I don't really know what to say as it relates to this case. Say there was absolutely no warning on this IQ dose that RaDonda want to get the medication from. Okay. I feel like there was plenty of opportunity for her to catch this mistake, for her to just realize that what I'm doing, but there is no other way that I can put this without saying I really wish that she has stopped to double check herself. In my first hospital system, once you override the med, it links to that patient MAR, as we refer to it. So even if there was a scanner in the radiology department, RaDonda could have still administered this med, scan the patient, scan the med, and administer it if the system that she works in is anything like my first hospital system. Because once you pull the medication, it automatically goes to the patient MAR, and if you scan the patient and scan the med, there will be nothing to tell you error. It will accept it. Now, in my current hospital, it is not like that. If you override a patient medication, it does not link to the patient MAR. So you will have to go and order the meds on the map for pharmacy to verify it, and then you can document later. When you override medication in my hospital system, there is you have to give a reason why. Unfortunately, according to multiple clips and some explanation, she said maybe there was warning, but she just did not acknowledge it. And I listened to another nurse who was called to testify that they asked questions. They said for some reason the nurse they had to override multiple things on their unit during their time. There was some glitch or breakdown in their system. If only this nurse has stopped to just look at the medication when she needed to reconstitute this vacuronium, given that she has administered Versed and know that Versed you don't have to reconstitute it, she would have caught herself. But just keeping that part of looking at the vial to see the name of this medication. And it's heartbreaking what I got from this case, and what I want to encourage other nurses is really speak up when there is a need. I recently had a situation where I was told by staffing to go and take a patient in the ICU. Now, I am a float pool nurse. I am cross trained to the emergency room. So I work in the ED. Um, and I know the system in the ED, but I am not trained to the ICU. I've gone to the ICU as a support staff, but never have I taken patient. I don't chart in their system because the documentation is slightly different from the med surg documentation, the cardiac unit, all of the unit I have trained on, including the mother baby center. Every unit has a documentation that is slightly different from the other. So even though I have background in emergency medicine, I am not cross trained in the ICU. So when the staffer told me to go there and take a step down patient, she knew that I wasn't cross trained there. The reason she asked me to go there was because someone had called in late and they needed a nurse. They were down a nurse. I was in a SWAT role, and SWAT role is just mean that I was a nurse without any patient assignment, but my job was to support the hospital, support other nurses, take patient, administer medication when there is a need for it. But I had no patient assignment. So when she asked me to do that, I told her, no, I am not trained in ICU. The first thing she said, Marian, I know you're not trained in the ICU, but we need you to take a patient, a step down patient in the ICU. And I told her, I'm sorry, I cannot go there. We are responsible for what we do. I remember in nursing school when I hear this case, I can just recall, I can just hear one of my instructor voice ringing in my ear. He says, you are the nurse. You are giving this medication. If anything happens, you are responsible. So you need, if you have questions, stop and ask questions. If you need to verify something, make sure you are absolutely clear of the order you are given. You understand what you need to do before you do it. And in any situation along the way, if you have any doubt, stop and ask questions. We are responsible for what we do. There is no doubt. Should the hospital be somewhat responsible for this and prosecuted as well? No question. Should the hospital take this blame 100%? No. And I just want to take this time to encourage nurses. Speak up when there is a need. So you will be put in situation at time where you are sent to a unit that you've never been to, like the example that I like the story that I told you earlier, or you asked to do something that is totally not in your scope. We need to know our limits, and we need to be very careful, because when these things happen, unfortunately, when you need to be questioned, no one will be there to answer for you. You are answering for yourself. You are the licensed professional, and you are liable for whatever happens on your license. So you need to speak up. We need to speak up for patient safety. We need to speak up for ourselves. We need to speak up to protect our patient, to protect our license, to protect ourselves. Do a favor or accept tasks that you are not familiar with. And we also need to rely on other discipline. We have pharmacy as resources to us. We need to reach out to them when we have questions. We have doctors who put in orders. If we don't understand their order, we need to clarify with them. And we need to be comfortable with saying no and knowing when to say yes. We can't rely on the fact that we are human beings and we make mistakes. Unfortunately, our mistake can lead to life-changing situations. So we really need to advocate for ourselves. Until the system change, we have to be the voice. Safety is a top priority. This case is really sad. You know, this nurse is a really young nurse, 35 years old. Very young, very, very young nurse. She has her whole life ahead of her. This mother that died, she died a horrible death, a horrible death. The family has to deal with the loss of their mother. She passed 3 years ago, and 2022, this case is all over again. I can't even imagine the trauma that they have to deal with, just seeing how this is playing out. And I encourage nurses too, For those nurses who absolutely disagree with what is going on and that this nurse was prosecuted, I think we need to be sensitive too. There were opportunity for this nurse to stop herself, for this nurse to just read the vial, for this nurse to pay attention. And the lesson learned here is that we have to be extra careful. We have to pay attention. We can't just rely on the system. Even when we're scanning medication, we still need to verify. The sixth right of medication administration is one that we cannot skip because it prevents error. If this nurse has gone through those six rites of medication administration, and especially when you're in a place where you don't have scanner and it's just you, that's when you should really go through your six rites of medication administration. Because if she had done that, we will not be here today because she skipped those steps. And even if she had just relied on her prior knowledge or prior experience of administering versus, she would have recognized that this medication is a little different. Why? That was a hint to slow down and look at the vial. But it's unfortunate. It's really sad that that was missed, and it really breaks my heart that we are here. I hope to encourage other nurses to speak up. When you put in a position where you know that it's unsafe, speak up. If you are asked to do a task that you are not familiar with, you haven't done, speak up. Ask for help. Talk to someone who have had experience with that. It is tragic. It is sad. Unfortunately, we work in a system that is not perfect, and sometimes we can be put in position that can really increase our chances of making mistakes. But we need to understand that in this profession, when we do make mistakes, those mistakes has a negative impact on people. So we need to advocate for ourselves. We need to say no when we feel unsafe or when we feel a situation will compromise the safety of the patient we're caring for and ourselves. This is even time for us to know our limit, say yes to what we can do, and say no to what we are unable to do. I love you all and thank you so much for watching. I'll talk to you later. Bye.